Good evening, or afternoon, morning, whatever time it is that you're watching the podcast. Welcome back. We're so happy to have you to join us today with a Time to Heal podcast. So, today, I hope this is going to be very beneficial to you and also very enjoyable. We're going to talk about patient advocacy. So, I'm going to ask you a question. How do you advocate for your own health? What does it look like when a person advocates for their health? And in asking you that question, we're going to address that. But I want you to do me a big favor and actually go to my website and send me a message if you don't mind and respond to that question because I really want to know about your experiences in advocating for your health. Okay, so let's get to the question as far as my responses and my answers to that. I think I told you during a previous podcast that I actually worked in the healthcare industry for over 40 years. I'm not going to tell you exactly how many, but well over 40 years. And I am a retired family nurse practitioner. And of course, I worked in the hospitals as a registered nurse and have done some of everything that is possible in nursing, with very few exceptions. So I've seen a lot, and I've seen people experience a lot on their health journey, and to see what that looks like when someone is advocating for themselves. So here's what I have observed during the course of many years. It seems that it is a real challenge for people to advocate for their health, and sometimes it's because they have questions, but they don't always know how to ask those questions. And I have this, I guess you could maybe call it a philosophy, that the only way that you're going to get the right answer is to ask the right question. So sometimes people just don't know the right questions to ask, and that's because they don't always have that knowledge base. And when they don't have the right questions, then it's very difficult for them to make the good, sound decisions that they need to make as far as options and alternatives. What's available to them for treatment and for just their health course. So that's one thing about questions. The other thing is about communication. Being able to communicate with members of the healthcare team. Sometimes people feel intimidated by doctors and nurses and those professionals that are taking care of them. I have seen people actually just kind of relinquish their power and literally give it over to the doctor. Whatever the doctor says or whatever the nurse says, this is what they go along with. But these things, I'm just kind of going down this list, but we're going to challenge these things a little bit and maybe make some recommendations or some suggestions for how you can deal with these things in a different way, in a way that's more effective and more beneficial for you. But there's this thing of intimidation and communication. Um, Again, with communicating, there's also the I want to say the language barrier, the terminology, um, medical terminology, these big words, the scientific words. Sometimes providers may be talking to you and maybe think that they're doing a good job and an effective job, but actually you're not understanding half of what they're talking about, and perhaps don't even want to ask more questions because you don't want to like look like you are uninformed. Um, so you kind of have this kind of dance or cover up going on, and after the encounter is over, you're wondering what in the world did he say or did she say or what did they mean, and so you go home with a lot of questions. There again, the lack of knowledge sometimes. Look, healthcare is complex. Medicine is complex, and healthcare system is complex. So to not have the sound knowledge base, that is nothing to be embarrassed about. I mean, none of us are experts in everything. You probably are an expert or very good in whatever your chosen field is. And if I were talking to you, if we were sitting down having a conversation, I'm sure I would find myself lacking a lot of knowledge in your field. So the same thing when it comes to healthcare. It's just that when you're talking to your doctor, to your provider, and you find that you don't always have the sound knowledge base to be able to get the information that you need in order to make the right choices. Um, yeah, so because of that, as I said before, Quite often, people relinquish their power. And I want to talk about that for a moment, relinquishing your power. When you relinquish your power and just turn it over to the hands of your doctor, you become passive, docile, and dependent on the other person. So here's what I want to say to you about that. And I hope that the words that I speak to you right now are going to be not just powerful, but empowering. I want to empower you to know this: you are the main person on that health team, on that healthcare team. It's not the doctor, it is not the provider, it is you. You are the most important person, and you're the one who has all of the power. Your power is the one that makes the final decision about how you move forward with a yes or a no. You have a right to have a full and sound understanding of treatment options that are being offered to you. And no, it's, we've all heard this statement before, that no question is a dumb question. I can't think of any situation where that is more true than a situation where you're dealing with your health and you have a question. No question is a dumb question. It makes all the sense in the world because you have it and you want to know. So I want to empower you to know that you're in charge. This is your body. God gave you the body that you're in, and you have every right and responsibility to take care of it and to make sound decisions about your health care. Now, the thing about healthcare, this whole healthcare system, as I said, has become very complex. And this may be shocking to you, but do you know that the top three causes of death in the United States? I hope you have your seatbelt fastened. Number one, heart disease. Number two, cancer. Number three, medical errors. Yes, the top three killers in the United States of America. So, advocating for your health is not just important, it is absolutely crucial. So, we want to talk about how Alpha Wellness, the company that I founded, that I work with, I want to talk about some things that we've been able to do to help people advocate for their health. How do we do it? How do we support that process? What could you expect to receive from someone who is a professional who is working with you to advocate for your health? This is really one of the things that I enjoy the most, especially since my retirement, but I've always done advocacy. To be able to go with a patient to their doctor's visit and to be able to ask questions about a particular topic that perhaps the patient doesn't even realize that there are other questions that should be asked in relation to what the doctor is talking about. But because that knowledge base is not there, the question never occurs to the patient. But I'm able to probe deeply, ask other questions, expand, so that when we leave that doctor's office, everything is covered fully and it can be explained in just everyday terminology. We go home or go to a restaurant, sit down and talk about the information that they just received, so that it's broken down in very simple terms, and they have a very deep and thorough understanding of what's being said, what their options are. And then when the decisions are made and how to move forward, they move forward with so much more confidence. And they have the power to know that this is a decision that they're making about their own health. Confronting insurance companies, there's another situation that we have encountered from time to time. And I don't want to get too deep into it, but let me just say this: the insurance companies are in business to make money. That's what they're in business to do. And so, in doing so, sometimes patients are not always getting the full range of benefits that they should be receiving. I'm going to give you a very brief and very specific example. I had a client who had an insurance policy, and part of the policy had, I think they call it like a rider. And this particular rider, which was like supplemental to their main insurance, this rider specifically covered cancer treatment, because cancer can be, treatment can be so costly. So that's what this rider was for. This patient was diagnosed with cancer. Unfortunately, that diagnosis did come. And At the time that they were diagnosed, then they were expecting that their insurance would cover the costs for the cancer treatment. And then they received a letter from the insurance company saying, no, the coverage that you have doesn't provide care for the type of cancer that you have. And this couple were absolutely devastated, knowing that the treatment was needed, knowing of the financial hardship that it was going to create for their family. And I was able to help them. They came to me, showed me their insurance policy, told me everything that they were facing. And I was able to look at that insurance policy, basically go over it very thoroughly, and to see what was actually happening was a matter of terminology. It was really, almost like shuffling cards, um, almost like a card trick. The way that the insurance company had the cancer stated in the policy was one way, and then they told the clients that that didn't cover the type of cancer that they had, but it was just a tricky way of using words. So what I did some research, researched some of the premier cancer treatment centers, because what I was looking for, I wanted to have someone like Sloan Memorial Kettering Hospital, or Cancer Centers of America, one of those premier treatment centers. I wanted to find somewhere in their literature where they were describing the cancer that this client had, and also having an overlap of terminology so that it also included the way that it was stated in the insurance policy, because I knew that the cancer itself should have been covered, and it was just a matter of terminology and the way that it was described. So I was able, through the research, to find exactly what I was looking for, and was then able to write a letter to the insurance company. And at the end of the letter, basically, I said to them, because I quoted my resources and the references that I had done through my research. And at the final part of the letter, I was able to say to them that a layperson who did not have medical training and education, there is no way they would have known that this cancer should have been covered by that policy. It was just the way that they worded it. And I thought it was deceptive, a way to keep them from having to cover the expenses that this patient would incur. And I said, this is a deceptive practice, and it should be reported to the regulatory board that regulates the way insurance companies operate. I want you to know, long story short, they got their attention, they reversed their decision, and they covered the care for this patient that they were paying for all along in their insurance. They had to pay for it, they had to cover it, and provide them with the care that they deserve. So sometimes you see these kinds of things, and how many people out there didn't know that, or would not have had that kind of advocacy available to them? Sometimes having to talk to the pharmacy, sometimes having to talk to a doctor. I'm thinking about a particular case now where a young woman was being treated in the hospital, and this particular hospital could not provide her the kind of treatment that she needed. And they had pretty much brushed it off. Oh, in fact, they didn't even bring it up. So I brought it up. What about this particular kind of treatment? And they said, oh, well, we don't do that here at this hospital. I said, okay, but is she a candidate for that type of treatment? And they said, well, we're not sure. Okay, then who would be sure? Who is the person who could answer that question, whether this young woman is a candidate for this particular kind of treatment? Well, the specialist that does that, we don't have on staff here. Then where will we find that specialist? Here again, long story short, this young lady was transferred to a different hospital that could provide her with the kind of treatment that she needed and that she deserved, that she could get the questions answered about whether or not she was a candidate for this more specialized treatment. So back up, and here's what would have happened without Alpha or some other professional there advocating for that patient. There's no way that this young lady would have been transferred to a different hospital. She would have stayed right there with the limited care that they had to offer, and only God knows what the outcome would have been. So, advocacy, having the knowledge to know that the quality of care that you're receiving, the benefits that you're receiving from your insurance company, that All the questions are being asked so that you can make sound decisions. All of this is a part of advocacy. And it's what one of the things that we do at Alpha Wellness. Now, what I would like for you to do, as I said earlier, just take the time to send me a note. You can contact me through our website, www.alphawellnessstl.com. Let me know your experiences about advocacy, and let me know if you're interested in having us to give you more information of how we can be supportive of you and your needs. Okay, I think that's all we have for you today. We're definitely going to look forward to meeting with you next time. But know this, without a doubt, that it is a time for healing.